Hi, my name is Serena Montoya, and for the project, I chose hypothyroidism. It is a disease that is categorized as primary and secondary hypothyroidism. What primary hypothyroidism is when the thyroid gland produces insufficient thyroid hormones. Secondary hypothyroidism is less common, but occurs when the hypothalamus or pituitary gland functions abnormally, and the thyroid gland actually functions normally. Um, about 0.3% of the United States population has this disease. About 0.6% or 2 to 10 per 1,000 pregnancies have complications due to this disease, which may cause spontaneous abortions, preterm birth, or fetal death. In severe cases of hypothyroidism, it may present as a myxedemia coma, which is more commonly found in older patients with a mortality rate of 25 to 60%, even with intensive medical care and early treatments. Groups who are more at risk for hypothyroidism include those who are older than 65 years old, females who are 7 times more likely to be affected by hypothyroidism than men, as well as pregnant women. Some risk factors that increase the likelihood of developing the disease include those who have autoimmune disorders or type 1 diabetes, those who have subclinical hypothyroidism or positive thyroid peroxidase antibodies, as well as those with a family history of thyroid disorders. So the symptoms may be mild and nonspecific and vary from patient to patient. The symptoms can range from mild to life-threatening. So, among the many different symptoms of this disease, the most common indicators include sensitivity to the cold, fatigue, weight gain, dry skin, constipation, voice changes, hair loss, muscle cramps, menstrual cycle abnormalities, and sleep disruptions. So, for treatments, that includes drugs that are thyroid hormone replacements, and that drug is usually or primarily levothyroxine monotherapy, and the dosages usually depends on the individual and their medical history as well as the severity of their symptoms. It's also advised for those who already have this disease that once they confirm a pregnancy, that they increase their dosage of the drug. Some consequences if this disease is untreated include increased risk of morbidity and mortality. It may contribute to physiological and metabolic issues and may also include goiter, which is when the thyroid gland becomes larger, heart problems, including a high risk of heart disease and heart failure, infertility due to the insufficient levels of thyroid hormones, which are interfering with ovulation, giving birth to infants with birth defects, and in rare cases, myxedema comas. And then these are my resources that I used, and thank you.